recording.
Hey everybody, my name is Jay Greco. I'm the clinical director of Lattimore Physical Therapy in Macedon, and I'm just going to go over some common stretches and core exercises for low back pain. So here we go. So the first one here is a single knee to chest and double knee to chest. I'm going to show you guys some pictures here in a second, but I don't know how to use this, so I'm not going to go back and forth. The next one, a hamstring and piriformis stretch, and then press ups. So we'll get to the first one here. No, we won't. We'll go to core exercise next. Core exercises, abdominal bracing and bridging, planks, bird dogs, and crunches. So now we'll go into some pictures. So the first two stretches were single knee and double knee to chest. Obviously, this first one is a single knee to chest. So with these two, you're going to hold for 30 seconds, repeat it about 3 times, do it a few times a day. This is typically good for patients with, tight muscles in their lower back, just to relieve some strain, some stress that can give some relief with that. If the pain increases with these stretches, you obviously don't want to do them. The next one is a hamstring stretch here on the left. So this one, you're going to hold the leg at the hip at a 90-degree angle, and then lift up the foot and leg, and you're going to hold that for 10 seconds and put it down, and then repeat it about 10 times. This one's actually good for patients with pain down the leg. It doubles as a nerve stretch too. So you're kind of putting that nerve and muscle on stretch and then relaxing it. And I would do both legs. Actually, I would do both legs for all these exercises because you just want to keep even. The next one here is a piriformis stretch. So that your piriformis muscle is deep underneath your gluteal muscles. Before I was talking about sciatica. Commonly, sciatica can be caused by this nerve running through the muscle from the piriformis muscle. So stretching this can decrease some of the symptoms in your legs when you do this. So you're pulling your knee to the opposite shoulder. You're holding it for about 30 seconds and you're doing 3 of those. And again, even if you have symptoms only on one side, I would do both legs just to stay balanced. All right, the next one is a press up. Now this isn't for everyone either, but this is what I do this with a lot of people for pain in the leg. This is commonly called cobra in yoga, but what we do is you repeat this movement. The guy is lying on his stomach. You're going to straighten your arms and press up, and repeat it about 10 times. Now, a lot of times when people have pain in their leg, after they do 10, they still have pain in their leg, but it may move from their calf kind of up their leg toward their buttock. And if you keep doing it, you're going to hopefully eliminate pain in the leg. Usually it'll settle in your lower back, and that's kind of what we look for with this. So if we get that, we call it a centralization of pain. If the pain centralizes to the spine, it's actually a good exercise to do. If the pain peripheralizes and goes into the leg more, then you don't want to do it. So be aware of that. Again, don't call me and sue me because this is a disclaimer. All right, the next stuff, these are all core exercises. So the first two, abdominal bracing and bridging. Doing an abdominal brace, what you're trying to do is you're just trying to draw your belly button toward your spine. Now this is like the basic, the beginning of all core exercise. So as you tighten your stomach, you're gonna kind of tighten everything around your stomach, not just your abdominals, but your transverse abdominals and kind of pull in your core. This is an exercise that I have people, if they have a hard time doing it, laying on your back, putting your arms down and just pushing your arms into the bed will kind of contract your muscles. And when that happens, that's an abdominal brace. Now from there, what we do a lot of times is exercises off of that. So the bridge is the next one. What you would do, first you would tighten your core and then you would try to lift your hips up off the table. And that just works your glutes, your lower back, your abdominals. It kind of works all the muscles. It's a great exercise. Bird dogs. We have cool names for everything too. So, bird dogs is this top one here. So it's like a pointer dog. You're gonna be on all fours, lift one leg up in the opposite arm. When you do that, you're keeping your core tight as you do it. It's going to work your lower back, your hip extensors, which are your glute muscles, and your abdominals. It's a good exercise. You got to maintain balance. So when you lift the opposite arm and leg, you hold it for a few seconds, you put it down, and then you alternate to the other side. I typically have people do 10 of those, take a rest, and then two or three sets of that. It's a tough exercise to do, but it's effective. Crunches. Crunches are good if your back is healthy, I would say. The more, if you have pain in the leg, I wouldn't do crunches. The more it puts more strain on your lower back, it can. But if your back is healthy and you're kind of progressed along in your exercise routine, then crunches are a good exercise for your abdominals. You just have to be careful about, this guy kind of has his hands on the back of his head. People tend to pull up too hard and cause neck pain. So you have to, when you do an exercise or crunch, you want to pick out a spot on the ceiling right above your head. And kind of when you do that crunch, you're kind of looking toward that spot so you don't over flex your head. I hope you guys okay with all this. Kind of running through it like speed demon here. The next one is probably my favorite core exercise, a plank. So planks are great because it keeps you in a neutral position. Not like the crunch where you're flexing your spine, but it keeps you in a neutral position from your head all the way down, to your feet. So you get this straight line. Now, when you hold this position for a while, I typically have people hold it. We'll start with like maybe 10 seconds, and then they work their way up, and people can go up to a minute or 2 minutes with it. I think the Guinness World Record is like hours or something like that. It's crazy. But holding this position is very productive for working your core, your glutes, your shoulders, everything. It can be used as a shoulder exercise. It's just a good exercise. All right. So that's pretty much my little spiel about all this. Do you guys have any questions for me at all or anything like that about either a specific exercise or pain or anything like that?
If you do, just click on the microphone on the lower left of your screen. There should be a red slash through it. If you click it, it'll go away and you can talk. I have a question. I noticed in lots of the exercises you went over that there's a lot of abdominal sort of focused things. Why is that important to your back?
So your abdominals they work around your spine. So the more that you're using your abdominals for exercise, the better protected your spine is from injury. You don't crunches aren't my favorite thing. I put it on there because everyone does them. But like doing a crunch creates a lot of strain on your lower back. If your back is, if you have back pain or especially like radicular type symptoms, you don't really want to do a lot of crunches. But in general, like abdominal strengthening in general is just a good way to prevent injury. So those abdominals attach to your spine and protect you from injury when you go to lift something or turn or twist or play golf or whatever.
Okay.
Well, no questions from us.
Pam, do you have a question? You got to click your microphone. It's all the way to the lower left and it has a red line through it. Can you get it? Early in your presentation, you talked about stenosis. What is that?
Stenosis is a narrowing of the spinal canal. So your spinal cord runs along your spine and in a canal. When that canal narrows with age, it compresses it and can cause pain in your back or down your legs, even weakness, things like that. You can also so as the spinal cord, travels down head to toe, there's the nerves come out on the sides of the spine, and they turn into different nerves and innervate muscles in your arms and your legs. They travel through little holes in your spine too, and that can narrow, and that's a different kind of stenosis, but it's also stenosis.
So everybody probably faces that at some point as they age.
There's some crazy stat that I had a paper, I was looking for it for this, but I couldn't find it. But basically, once you're 30 years old or something like that, everyone has a form of degenerative disc disease, which is normal in people. And then as you get to a certain age, it goes from 50% of people, and then when you get up to 50, it maybe turns to 65% of people, and then when you get to 75, so it's an aging thing. But everyone has it. So when people get x-rays, so this is the other reason that, we don't love imaging as therapists, because when people get an x-ray or an MRI, it literally says everything. And it's super scary for people when they see an x-ray that says, you have degenerative disc disease. Degenerative is the worst word ever.
Yeah.
It makes you seem like you're falling apart, but it's literally in everyone. So, it's usually not the cause or the source of the pain sometimes. So it's not necessarily the degenerative disc that's causing your pain. It might be something else that isn't seen on x-ray, like a disc. So x-rays just show bone, while MRIs show soft tissue like muscles and discs.
Good to know. Pam, I see you're unmuted now if you have a question.
Yeah, I didn't find the microphone.
Well, you did. Well, you found something because we can hear you.
An invisible microphone.
Yes.
No, I'm good. I'm good.
Okay.
All right.
I'll try some of those exercises and see.
Yeah, they look good.
Yeah, they're good. Don't go crazy if they're sore. If they
Yeah.
cause pain, though, just be careful.
And start
All
with
right.
just a few seconds and work up.
Yeah, start with those first couple exercises where you pull your knees to your chest. If you have just a general low back pain, doing those knee to chest exercises is a good way to just stretch out your lower back and glute muscles, especially after overdoing or whatever
Too
causes.
much gardening, Pam.
Yeah.
Yeah.
Well,
Having
thank
those
you.
nice days with, yeah.
Thank you so much for your presentation, Jay.
Yeah.
And I will share this out with people. And remember, you can refer to our YouTube channel. The stretches will be there in case you want to try them out.
Great. Thank you so much.
Right.
Have a great day.
Thanks for having me. Take
Thank
care.
you.
Thank
Bye.
you.
All right. Bye-bye.
Bye.